I would have articulated in the local space that people don't leave for money only. People leave for opportunities.
Yeah.
And people leave for some basic things, sir. People leave. I have a child who is special needs. Jamaica can't help me. So I have to go to a country where I can work and send my child into a space that I know they are cared for and protected professionally. Jamaica.
A crisis is forcing Jamaica to confront one of the biggest challenges facing our healthcare system. Every year, highly trained Jamaican nurses leave for opportunities overseas, creating difficult staffing shortages in hospitals and health centers across the island. Now, a candid exchange between Prime Minister Andrew Holness and the President of the Nurses Association of Jamaica has reignited the national debate over the realities of nurse migration. Is this simply a matter of better salaries abroad, or are deeper issues driving healthcare professionals away? And what does the continued loss of experienced nurses mean for patients, communities, and the future of public healthcare in Jamaica? In this report, we examine what both sides are saying, the facts behind the migration trend, the impact on Jamaica's health sector, and the difficult choices facing policymakers as competition for nurses intensifies around the world. Stay with us as we separate fact from opinion and take an in-depth look at one of the country's most pressing workforce challenges. Nurse migration debate intensifies as Nurses Association and Prime Minister address Jamaica's healthcare workforce crisis. The long-standing issue of nurse migration has once again moved to the forefront of Jamaica's national conversation. Following recent discussions between Prime Minister Andrew Holness and representatives of the Nurses Association of Jamaica, NAJ, while both sides agree that Jamaica continues to lose highly trained nurses to overseas recruitment, the discussions have highlighted different perspectives on what is driving the migration and how the country should respond to the growing challenge. The meeting underscored that nurse migration is no longer simply a labor issue, but one that has significant implications for healthcare delivery, public investment, and national development. The Prime Minister met with the leadership of the Nurses Association as part of ongoing consultations aimed at strengthening Jamaica's public healthcare system. During the meeting, the government reiterated its commitment to increasing support for nurses, improving working conditions, and expanding opportunities for professional development. Officials acknowledged that nurses remain one of the country's most valuable human resources and recognize their contribution to patient care across hospitals, health centers, and community facilities.
A little longer than most, but my job is to change it. But the bureaucracy can become entrenched and say, who am I to be telling someone who is trained in the area understand the bigger picture to say change? So it's very important that I hear how do you see it? And then I try to understand how other people see it. Maybe there is something that is a balance of interest. Maybe the interests of the nurses have to be balanced against some other interests.
Migration is about more than salary. According to the Nurses Association of Jamaica, the continued migration of nurses cannot be explained solely by wages. The association has argued that many nurses leave because of a combination of factors, including heavy workloads, staff shortages, limited opportunities for career development, burnout, inadequate workplace resources, and concerns about overall quality of life. NAJ President Dawn Marie Richards has maintained that many nurses enter the profession with a genuine desire to serve Jamaica, but eventually conclude that remaining in the local healthcare system is financially and professionally unsustainable. She has argued that experienced nurses are often responsible for increasing patient loads as vacancies remain unfilled, creating additional pressure on those who stay behind. The association has also pointed to the aggressive international recruitment campaigns conducted by healthcare employers in countries such as the United Kingdom, Canada, and the United States. These employers frequently offer significantly higher salaries, relocation assistance, housing support, continuing education opportunities, and clearer career pathways. For many Jamaican nurses, these incentives represent opportunities that are difficult to match locally. According to the Prime Minister, government cannot prevent nurses from seeking better opportunities. Prime Minister Andrew Holness has acknowledged the reality that nurse migration is driven by global labor market forces. He has stated that Jamaica operates within an international healthcare market where developed countries actively recruit qualified healthcare professionals from nations with strong nursing education systems. Rather than suggesting that migration can simply be stopped, Holness has indicated that the government's objective is to improve conditions sufficiently so that nurses choose to remain in Jamaica. He has emphasized ongoing investments in healthcare infrastructure, expanded training capacity, and initiatives aimed at improving the overall working environment for healthcare workers. The Prime Minister has also noted that Jamaica continues to produce highly respected nurses whose qualifications are recognized internationally. While this reflects positively on the country's education system, it also means that Jamaican nurses remain attractive to overseas employers facing shortages of their own. The economic cost of nurse migration. The migration of nurses carries significant financial implications for Jamaica. Training a registered nurse requires substantial public investment through government-funded educational institutions, clinical placements, and healthcare infrastructure. When experienced nurses migrate shortly after qualification, the country loses both its financial investment and valuable clinical expertise. Healthcare administrators had frequently expressed concern that replacing experienced nurses is not simply a matter of recruiting new graduates. Senior nurses play critical roles in mentoring younger staff, supervising clinical practice, and maintaining standards of patient care. Their departure can therefore affect the efficiency and quality of healthcare services beyond the immediate staffing shortage. The continued loss of specialized nurses also creates additional challenges in areas such as intensive care, operating theaters, emergency medicine, and maternal health, where experience is particularly important.
The job. So you are appointed as a level 1 registered general nurse. You go and you do a post-basic training in midwifery, psychiatry, accident and emergency, operating theatre, whatever it is. There's no post to appoint you in. Or if there's a post, somebody is sitting in the post who did admin but can't move up because there's no sister post. And the challenges go on and on. Prior to this, we used to employ people temporarily. So they are employed on a temporary, well, it's called a temporary employment, but they are employed. And they would be paid as registered nurses. We don't have that system anymore. You must be aligned to a post. Some of the dynamics we really would want persons to sit and understand and don't look at things just so. Because you look and you say, we have factors that are going against the employment of the new graduate. A lot of
A global challenge. Health workforce migration is not unique to Jamaica. Many Caribbean countries continue to experience similar challenges as wealthier nations recruit healthcare professionals to address aging populations and domestic labor shortages. The World Health Organization has repeatedly highlighted the unequal distribution of healthcare workers worldwide, with lower and middle-income countries often training professionals who later migrate to countries offering substantially better remuneration and working conditions. For Jamaica, this creates a difficult policy balance. Restricted migration would conflict with individual freedoms and international labor mobility, while failing to improve domestic conditions risks accelerating the loss of experienced healthcare workers. areas of common ground. Despite differences in emphasis, the recent discussion suggests that both the government and the Nurses Association agree on several key issues. Both acknowledge that Jamaica requires more nurses, stronger retention strategies, and continued investment in the healthcare system. Both also recognize that improving working conditions, expanding professional development opportunities, and strengthening support systems are essential if more nurses are to build long-term careers with Jamaica. The discussions further reflect an understanding that solving the migration challenge will require a combination of competitive compensation, improved workplace conditions, expanded educational opportunities, and long-term workforce planning rather than relying on any single policy intervention. The dialogue between the government and the Nurses Association comes at a time when healthcare systems around the world continue competing for qualified nurses. Jamaica, therefore, faces the dual challenge of continuing to train high-quality healthcare professionals while creating an environment that encourages them to remain. Whether future policy measures succeed in slowing migration will likely depend on the government's ability to address the broader concerns raised by the frontline nurses, including workload, staff levels, career progression, and workplace support. As international demand for nurses continues to grow, these issues are expected to remain central to Jamaica's healthcare policy discussions in the years ahead. Subscribe today, turn on notifications, and never miss the stories that matter most. Jamaica News Now, your Highlands, your news, right now.